This is the Board of Health meeting.
Morning.
July 20th, 2020 at 10:30 in the morning or around that time. We will start off with approval of the minutes for June 22nd, 2020.
I make a motion we
Approval.
accept them.
Okay, second.
All in favor?
Aye.
Aye.
Aye. Okay. Moving along pretty quickly, we're going to start new business. Energov Launch, inspection and permitting Tyler software. So Gal, I think that's your takeaway.
Yeah, so this is the last phase of our Tyler software implementation. So we saw a lot of the financials go in first, and then human capital portions of it, I guess is the right, I don't know if that's the right word. But so the last phase is the Energov Launch, which is will be all the inspectional and permitting software, and it'll integrate into our financials, which will be a huge help. But so it's our department, building department, planning, zoning, conservation, some portions of the fire department that do inspections. So it's a pretty big thing. It's a year-long process until it actually launches, but we'll be building out that system. And it's something we've been waiting for a while. And it includes things like electronic inspections on iPads and stuff. So it's very exciting. I'm thrilled we're finally moving forward with it.
So this is for the whole town, not just the Board of Health. This is for everybody in the town.
Yep. So all those departments will be involved, and businesses and residents will eventually be able to fill out applications online and renewals online, and it will input right into the database. So right now we get all paper-based applications, and then Jen has to input things into the database and make sure they're corrected every year and updated. So it's very labor-intensive. So now all this will fall directly into the database and, again, interact with our financials. So all the payments will come through and funnel right into the right accounts and everything, assuming it all works perfectly, right?
Why so long? Why so long in the wait?
Why does it take so long to build up? Because it's specific for us. So we have to actually take every single code that we enforce and digitize it. So we have to put it in an Excel spreadsheet, which that itself is a huge undertaking. And then building out the workflows on how we want things to happen. First the application comes in, then, it gets reviewed, then an inspection scheduled. So it's a lot of organizing, and that's just our portion of it. Now, I can't imagine what happens in the background with the IT department in their whole implementation phases.
Thank you. I understand. Yeah.
Okay. Any other questions from anybody?
Nope.
Okay. Moving right along. Norwood Hospital status update. Joan, I don't know if you know any more than the rest of us know, but you're on the board there, you might know more.
Well, all I can say is that we had a meeting, it would be 2 weeks on Wednesday with the bigwigs from Texas and wherever else they're from. It was George Yusevich, myself, and Jerry LaRusso. And they talked about the LaRusso building being torn down because the roof drains were not able to handle all the rain that came down. So it opened the roof up there, and it came down from the third floor to the second floor to the first floor and eventually into, the basement. But, and they figured it wasn't worth trying to find all the mold that would build up. It was less costly to tear it down and put up a new one than it would be to renovate the whole hospital itself. The Youngdale building is going to remain. There was no damage there whatsoever. And I guess the cath lab made out pretty well. The the cafeteria, I guess, was absolutely destroyed from what I saw. The brand new cafeteria was just decimated. There was nothing left. I mean, it was a horrible scene. It really was. So they're planning on having the emergency room open from, it was 2 weeks, almost 2 weeks that we met. They said 4 to 6 weeks, figure 2 months before the emergency room is open. And then the second phase will be the cardiac cath will be open because they can't do that sooner because they need beds for the people that are having that procedure done. So then in the second phase, they're going to have 15 beds available for that and any emergency room things that are coming up. And as I said, that will be let's see, what did they say? Probably 4 months that will be up and running. If they can get it done sooner, they can do that. And they're planning on the LaRusso building being a little bit bigger, but I think they're gonna have a problem doing that because I mentioned that street behind the emergency room where they wanted to expand it to is owned by the town. So that was kind of like a cog, you know, messing up the wheels. I think that's about it. So they plan on having what they called a mini hospital up and running all within, say, 6 months' time with all the ancillary services that they need. Meanwhile, the doctors, a lot of them have gone over to the Guild building, and all the x-ray stuff and whatnot right now is all being done at the Guild building. I guess some of the doctors have already gone over to it's over by the racquetball club there. I can't think of the name of the street. Anyway, some of the doctors are over there seeing people now.
The surgery center?
I'm sorry?
Is it the surgery center on Moore Street?
No, it's the
No.
one over by the racquetball club.
Oh, the Vanderbilt Club. Yeah.
Vanderbilt. Yeah, it's over on Vanderbilt around there.
The urgent care.
It's the building behind that. Oh gosh, I can't think of the name of it right off the bat. But anyway, there are a lot of doctors over there now too. And they're
What is
saying,
it? Is it,
what?
excuse me, Jody, is it a medical facility that people can go to where they are, or? I'm not sure what you're saying. These doctors are practicing out of that building, or?
Yes, the offices are. You know, like
Maybe
the
Jill did a medical.
dermatology associates and all those people are over there.
Okay.
Behind there.
Oh, I know where she means.
Yeah. And the rest of the doctors have gone over to across the street to the Guile building. And then there's 95 Chapel Streets, you know, that's some of the doctors are over there too. So they're pretty much there's some of the doctors down in Dedham, right at the Rotary there. They have like a medical, what do they call that? There's one over like a surgery center.
Yeah.
Down in Dedham, right at the Rotary there. And then where's the Chinese restaurant place? What's that called? Oh God, I'm terrible. Anyway, there's more doctors and there's a surgery center over there too.
Joan, can I ask another question, please?
Sure. Yeah.
Are the doctors applying for any more admitting privileges for their patients anywhere else? Or is it still Stewart hospitals?
Oh, it's still Stewart hospitals. What they're doing, like if an ambulance picks them up, they'll take them to either St. Elizabeth's or Brockton or, any of the other Stewart hospitals that are available. So basically.
So nobody else is taking the patients, nobody else. We can't request, a local resident asked me that, if we could request the ambulance to take them to Newton Wellesley.
I don't know. That would be up to the fire department.
Yeah.
I don't know what their services are, but I would say you could probably go anywhere within reason you want to go. But that's all I have.
The reason they'll be
Thank you.
Carolyn, the reason that a lot of them will be staying with Norwood Hospital is because a lot of the employees that work there carried Steward Health insurance. So
good.
They have to go to a Steward Health facility. So those people would be taken to a Steward facility. But as Joan said, it is up to the fire department if they can take you out of town. I think it all depends on how busy they are, or if they're down an ambulance, they're not going to take an ambulance out of town. But
No.
that's something that they specifically should ask the fire chief. That's, if they're going to allow that. I know that they have in the past, they've taken people into the Brigham and that type of thing. But I think you would definitely have to ask the fire chief that question.
Thank you. Yeah.
The other thing that I know about the hospital is that the hospital is working with the nurses and with all of the staff, try and make sure that they all have positions available. If they, obviously they can't give 1,000 workers positions in all of this. facilities. But they are working closely with the nursing staff and the other staff to see, make jobs available for some of them at least. And unemployment is an option for them as well.
That's a
Right.
huge help from them. That's wonderful. Yeah, thank you.
So bottom line is 2.5 to 3 years, the new hospital will be up and running, so. Okay,
And once they get it all figured out, they'll get, this emergency room covers 26 towns. So they're gonna wanna get that up and running as soon as they can to make it available to all the people in those 26 towns. I mean, granted, there are other hospitals that they can go to, but it also is easier if you live closer to one to be able to go to one that's close. So we'll wait to see what happens, but that's the most I know anyway.
Well, it is a loss to the community, so anything we can get sooner for our communities and our townspeople would be wonderful.
Yeah.
Thank you. Thanks, Joni, Jay, Kath.
hey, no problem.
All right, old business. Update on public health nurse applicant search. Val?
So we have interviews scheduled today and Thursday. So we hope to get a candidate hopefully by the end of the week. We'll see how the interviews go, but we're moving forward with that.
How many?
We are going to interview 4 people.
Good. Thank you.
Oh.
I'm pressing. It's not unpressing, Kathy.
Oh, well, it stopped anyways. All right, update of COVID-19.
So I thought I'd update the numbers here, and then during my report, I will talk about all the activities that we've been doing. The state every Wednesday, the state issues the town by town report, and they revamped it last week to report different numbers. I actually think the numbers they're reporting are more indicative of what's happening now. It's a lot of things relative to the last 14 days. But it really changed. We were tracking things with the old data they were reporting. Now they're reporting new data. So we can't track it week by week. Although I assume the data will stay the same going forward. So some highlights from the data they report was our percent positive is really low. It's at 1.7% over the last 14 days compared to the state, which is 2.25. So that's a great number. We continue to have a good testing rate. Which is higher than the state rate, so that's just something to compare it to. Overall, our case numbers is 584, but again, a more accurate number is sort of the week by week count that I report out, and it's only really a handful of cases every week, under 10 in the last 8 weeks. So our numbers continue to look good, just like across the state, and continue to be low. I think that's all good signs. And considering how much we've reopened our society, I think that's a good thing. We know what we're seeing in other states, but here in Massachusetts, knock on wood, the numbers still look good. And I think that's because people are taking the precautions and are listening to public health advisements.
So Sadal, with our great, maintaining our low count, what is your input to the school department for opening up? Or you want to go at another time with this, or just like to address it to people who might be listening, or what you feel is what we're leaning towards, or your input to the school department? There's so many parents, I'm sure, as you as well, wondering what's going to go on. So I think that, our numbers are great. Is it an individual town thing? Can Walpole go to school and Norwood not? Or can Norwood not go to school and Walpole not? Or is it a universal Massachusetts thing? Or you hear so many crazy things.
Yeah, so the schools, we have been talking with the schools. They, by the end of the month, they have to come up with 3 tentative plans. So a complete in-person plan, a hybrid plan, and a virtual learning plan. So they have to submit those 3 reports to the state at the end of the month. The state will get back with information by August 10th, and then that's when the schools, right now, that's the plan of when the schools will announce which plan they're going with. A couple districts have already
Could you
announced.
explain,
Go ahead, sorry.
could you explain what a hybrid plan is to the community?
Sure. So a hybrid plan is a mix of both, and that can look very different depending on what the district plans. So I think the one that I've seen is a week in, week out. So mainly because of space and classroom size, in order to allow for social distancing, they can't have the full number of students in the school. So they would take half in the school and half would be virtual that week, and then they'd swap. But every district makes their own plans and makes their own decision on which plan they're going to go forward with. So the scenario like you described, yeah, you'd say Walpole could be in school and Norwood could be a hybrid. There could be any scenario. I think, we'll be having conversations with the schools. It is, of course, up to the schools, but we will be advising them. It's an incredible undertaking that they have to do to write these plans. The logistics, everything from the bus system to the teachers and who, it is such a complex system with so many moving parts. I feel not envious of them to have to write these plans and then trying to implement them. And I think as a community, we need to be understanding and patient as the schools work through this very difficult process to try and plan for this.
It sounds like it's a difficult process. I mean, somebody was saying to me, let me ask you this scenario, Carolyn. If a teacher, this is what they said to me, if a teacher comes from an Attleboro area and she teaches in the Norwood school system, and Attleboro is a very high active COVID, and they come into our school systems, what do we do? I said, well, I'm sure that the teacher would be tested for COVID prior to her, coming back to school. Well, how do you follow through with that all year long so that we make sure that these teachers that are coming from high COVID levels, you know what I mean, integrate into our school system?
Well, I think there will be a large
right?
emphasis. There'll be a large emphasis on social distancing, and I think when we look at the transmission of COVID, it's much less among children. So I think when we look at control measures, a lot will be focused on the adults because they do transmit better than children transmit the virus. We always do the comparison of flu. Kids are very good at transmitting flu. From what we're seeing from the science, kids are not very good at transmitting COVID. But of course, we still want to take all the precautions. So social distancing, face coverings will be very important in the schools. Hand hygiene, hand washing frequently, sanitizing frequently, and of course the cleaning of surfaces. So I think all those things become very important once you start to bring people together in any form, but particularly with the schools, because it just is such a large number of people coming together. One thing that we will work really closely with the schools on, and there was actually just some guidance issued today from the department, DESE, department. I'm going to mess up the acronym what DESE stands for, but that's the state department that advises and regulates schools about what happens when there's a positive case, because there will be positive cases. There's no such thing as zero risk. We can do everything in our power to mitigate the risk and lower the risk. But, I think we need to anticipate that there will be positive cases. And what do we do? How do we handle that? How do we communicate it? How do we communicate ahead of time so everyone knows what's going to happen? So all those plans are what we're working on now.
And those are universal plans for the state, or those, again, how we would handle it, just Norwood plan?
There's some guidance and some information from the state, but the specifics of what happens in Norwood will be, us working with the school department on how we'll implement the guidance from DESE.
Thank you, Sadal. I know they're hard answers. I mean, it's just that people, want to just get a head start on it, like anybody would, to see where their future is with their children. Thank you. And Nick?
Okay. Any other questions from anybody? No? Okay. Update on Household Hazardous Waste Day.
Oh, great.
Don't everybody speak once.
All right, let's do it.
Yeah, I do anticipate we'll move forward with Hazardous Waste Day. I don't see any reason why not. We can do social distancing at the site, and we do require everybody to stay in their cars anyway. So I do anticipate that we go forward. At this point, it looks like Hazardous Waste Day will go forward as usual.
Good.
Okay, what do we got for the poor
What day
lady
is that?
standing? What do we have for the poor lady standing at the top of the driveway collecting money?
We will probably have a face covering for sure, and maybe even a face shield and some gloves. So we will put extra PPE on, especially someone that, you know, interacts with everybody that comes in. And maybe we might think of reassigning positions to ensure those at high risk aren't in contact with so many people.
I don't see a problem.
And what date is that?
September 26th.
September 26th.
Question, is there any way, Sigal, that we could, instead of people giving cash, is there any way we could look at maybe getting a square or something so that we're not handling cash and that people bring a debit card or a credit card with them?
Oh, I doubt
That is a great idea.
It's a good idea,
Yeah,
but it'll work.
Well, I think maybe if we, you know, if we're able to get it and we get the notification out there, people are very about even handling cash because they don't know who's handled it before them or, you know, so I think if we have that available, I mean, we could still take cash as long as you wear gloves when you take it, but I think we ought to look into seeing if we could get some type of device that we could take a credit card or a debit card, that people would feel more comfortable using that. That way they put their own card in, they handle it, we don't handle it at all. We just handle the machine.
You'd have to have some kind of a stand there where you could have these machines that will accept it. One person couldn't handle all those machines in their pockets and stuff like that. You know, I'm sure there's a way that we can do it, but.
Yeah, well, the square,
And what about out front?
the square actually attaches to your phone, so it's not, I mean, I don't know what else is out there. I'm just asking if maybe we can look into see what other devices might be available to use.
So technical.
Yeah, I think it's a great
out front,
idea.
when I ask everybody, what about out front? I'm handing them the papers, we're taking them back, we're giving them pens. I'm sticking my head in there looking at their license and we're having a nice conversation. What about that part of it? The exchange of pens with everybody. Not a concern anymore?
I don't think we're gonna do it.
Yeah, I think we'll change some of our procedures like that. I think, Stacy, did you want to say something?
Yeah, go ahead, Stace.
Yeah, I was
Hi,
going
Stace.
to Hi, Carolyn. I was going to recommend changing some of our procedures, even having the payments down on the hill. I think everything should be done up top. I didn't like you being on that hill anyway, and you're slowing things down. I think if we can kind of get some payment along the street or have it just a little bit set up better up at the top, then we can get rid of that top mid-hill.
But we on the street,
Space.
the people on the street are checking their dump stickers. We're now looking at their light bill, their mortgage bill they bring me if they don't have a dump sticker.
Yeah.
I mean, I'm looking at their license. I have to hold it to see if they're, you know, from Norwood.
I agree. We're definitely going to have to look at our procedures and change.
Definitely. Because I'm giving them pens, they're giving them back. I'm giving it quickly
Yeah.
to the next car because that car's moving on.
Well, I think
We need to get the word out ahead of time and of our procedures. So we need to work on that now and really advertise it and get the word. Because there's going to be some tough work for that come.
the other piece of that, Stacy, is that I think we need to, it's a little bit dangerous on the street for us to be standing out there. So if we're gonna take the cards or cash or whatever we're gonna take, we can move that forward. We can have that closer to there's a little drive out there. At least it gets us out of the street, because I get nervous that there are people driving up and down that street, and I don't want to see them take out one of us because we're
Right.
standing.
Kathy, that's a pretty wide street. We might have to put some blockades up and really narrow it down. Have some signage,
Okay.
and have the police officer that's up there really direct the opposite traffic. Narrow that, almost cut that lane in half, so you have a nice wide area with even if we have to put some sort of a barrier up there. I agree with you, Kathy, because people speed by.
Yeah, I don't want
And
to
we have
see
to be courtesy of the home on that street that enters and exits. The house that abuts the cemetery and is very active coming in and out. We have to be courtesy them too. Okay, well, we got to work on that. So that's going to be
Yeah.
something that, you know.
I mean, I
These
think we can do it. I just think we have to look at some other ways of making it happen so that it's safe for everybody, including us as the workers, so that we don't get hurt either, or get, exposed to somebody with COVID. Hopefully not. Okay, so we have a little bit of work to do on that before September 26th. So. All right, moving on. Public health report. Nick?
Yes, so can everyone hear me?
Yep.
Okay, good. So from the public health nurse report, you'll see that a significant amount of the time is obviously devoted to COVID related stuff. So I did a breakdown in the report of the cases and types of cases that we've seen in the health department from the last meeting to Friday. And so kind of like Sigal said, we have a lot of the cases are, I think you had mentioned, Sigal, like some of the data now that we're seeing in the state is what's confirmed, but a significant amount of what we do is those probable cases in the report, which is people that go and get blood work done for COVID-19, and then I follow up with them to make sure that they aren't, having symptoms or what have you. And then contacts are another big part of that. So people that have been in contact with someone that tests positive for COVID. And the other big thing is not to let COVID take the whole spotlight. The section I did on ticks is important as well. Since I did the report, I think I've had like 4 or 5 Lyme disease cases reported as well. So as people go out, particularly since they're, a little house crazy from COVID and they want to do nature walks and that sort of stuff. One of the links I put in there that's really important is the mass.gov, the ticks. It's mass.gov, mosquito and tick. That one has a lot of really good information on how to prevent tick bites, because this right now is kind of like peak season for when we're going to be seeing Lyme disease cases and what have you. So it goes into a lot more than just putting on mosquito repellent. There's a lot of really good tips that residents can look at to prevent themselves from getting a tick bite or mosquito bite in the first place.
Okay, good. Also, you also got vaccine for the flu clinic for the fall?
So the vaccine has been pre-ordered. We haven't received it yet, of course, but we do have the vaccine was pre-ordered back, I believe, in February or March. So that's already, that order is in. And so once the manufacturer I think it'll be, usually those vaccines start to come out in like August. Stacy, I don't know if they usually get it to us in August. Okay. So yeah, we already have that all set.
You think 700 doses is going to be enough?
Well, 700, I believe, is what we used last year, if I'm not mistaken, Stacy and Sigal. Last year, I think that was a sufficient amount. I think we actually ran through all of it last year. I think we ran out by, like, if I recall correctly, by February or March or something like that. So I think it will be a sufficient amount.
Thank you.
And Stace, this is a question for you. Do you think we're going to change away how we do the flu clinic as well?
We are looking right now. Sigal and I have been talking to some other communities about possibly looking at drive-through clinics as a possibility. With that said, if we go back to the traditional way, obviously the nurses and will have to have protective gear. We'll have to do the social distancing. It will be run definitely a little different, not a lot different. So we're looking at those 2 different things. So we will probably still continue to do first responders. We'll have a town hall clinic for employees. We'll do the senior, we'll go out and do those small clinics. We will just have to be using, obviously, the specific guidance to protect the nurses and to protect the participants that are coming there, so they're not all congregating in a big group. So
Yeah.
we will probably still continue that. And last year, if you remember, 200 people, we got approximately 200 people at the senior clinic. We could also look at doing it at another site. If it is a drive-through clinic, it may not be at the senior center. It may be at the high school or another facility that has a easier road access. So those are all things we're looking at right now. And hopefully we'll have some more information at the next board meeting.
Okay, good.
Can I talk to Nick for a minute? And I'd like to address the board that I had somebody very close to my family be tested for COVID. She did not have it, but her association with Nicholas was far what we could have ever expected when we hired him. He was superb. He was excellent. He was kind. He was informative, reached out several times to this person. And she couldn't say enough about Nick's, seriously, Nick, about your compassion and understanding of what was going on. So I think we got a bonus. You know, you never know. You always think you know, but I just heard that like 2 weeks ago. And so I wanted to let everybody know that. Thank you, Nick. You got an A+.
Thank you. And I'm very
But you're not
happy to
getting
hear-
a
I'm
raise.
very happy to hear that. Okay.
Thanks, Nick. I just wanted to let the board know as well as you what my feedback was. Thank you
Thank
very,
you.
very much.
I also wanted to compliment you on the way you set out your report. It was very easy to read. It made us probably not having to ask a lot of questions because it was explained very well. So kudos to that as well. For somebody who's just started, you're starting off on a great foot.
Thank you. I will definitely keep the format then.
Excellent, thank you. All right, Aubrey, you're up. Impact Norwood.
I'm up. Good morning, everybody. It's nice to see all of you.
You.
So Impact Norwood has finished its kind of impromptu webinar series for the summer. When all of this started, we wanted to get as much information out about mental health and how to take care of yourself through this really difficult time. All of the webinar recordings are up on the Impact Norwood website, with the exception of the last webinar that we did. It was with Dr. Elizabeth Englander. She has an incredibly impressive resume. I won't go over it here, but she addressed parents on how they can help their kids manage screen time, because we know, these are very different times and it's not a normal time. And people were concerned about the amount of time that kids were spending on screens. So she goes really in depth about explaining how to manage that. Unfortunately, she didn't want the webinar to be just posted for anybody to see, but I do have the link to a recording. So if anybody wants that, you can email me at aciol@norwoodma.gov. And if you don't remember that, there's a form submission on the Impact Norwood website. You can request that link through there. So yeah, we're done with the webinars for now. Another big thing that I've been working on, I've been collaborating with other substance use prevention coalitions from around the state. A few of us were involved in a webinar series that the Bureau of Substance Addiction Services put on about systemic racism and the role that coalitions can play in addressing that. So we've been meeting, we have another meeting today actually, and we're putting together kind of a statewide conversation with other substance use prevention coalitions on what our role is in addressing systemic and institutional racism. So I'm pretty excited about that. We want to make sure it stays at the forefront. And what else? So much. I think the biggest update that I have, Daryl Sweeper is no longer with Impact Norwood. He recently moved to Pennsylvania to start his residency at the hospital down there. So we are going to be looking for a new program coordinator for Impact Norwood. So I think that's the biggest update I have right now. And lastly, we are hopefully going to hear from the Metro West Health Foundation soon about how we can implement the youth survey that we do every 2 years, with schools not really knowing how they're going to be opening The survey they can't plan for the survey yet. It can be online or in person. So it will happen. We just don't know how it's going to happen yet. So that's it for Impact Norwood. I'm sorry that was so fast.
Okay. Good. Very good.
Any questions?
You-
Or?
Thanks,
And if good luck to Daryl with his residency. That's huge. So good luck.
Yeah, I think he's going to do some great things. So,
Yeah.
How are we
be
going?
missed.
How are we going to go about implementing finding a new Daryl?
So I actually just got the job position sent over to HR last week. So they're going to post it. I'm going to see if we can get it distributed to some of the public health schools, just to see if any students are looking for part-time work. And then we'll conduct interviews via Zoom, most likely, or GoToMeeting, similar to how they're looking for another public health nurse.
Okay, so Segal and Stacy will be involved in the hiring.
Segal, myself, and I would actually like a youth from our youth ambassadors program of Impact Norwood to be involved in the interview process, because the position primarily works with the youth, and I want their perspective in hiring.
Okay, but we have the bottom line on who it is then.
Yes, Segal and I do, yeah.
Good.
Aubrey, how much longer is that grant for a position? I know it's part-time, but how long? Much longer?
So we are in year 3 right now.
So it's 5 years.
Yep, we have
Last
5
two.
years. We have 2 more years, and then we can reapply for an additional 5 years.
Okay.
Yep.
Thank you, yeah. So we get some longevity to offer somebody, that's what I meant, so that's gonna be good.
Yeah, yes,
Thank you.
yes. And Segal and I also applied for another grant back in March, which seems like a decade ago at this point. But we're waiting to hear back on that, and that grant would also help with the substance use prevention work, and that's for 5 years as well. So hopefully we get
Thank
it.
you.
We haven't heard anything.
Thank you, Aubrey. Okay, sanitarian report.
Come on, Angelo.
Good morning. Do you want to do the new food establishment report first and then? the
Yeah,
inspection?
that would be good.
So we have 2 establishments that have opened since our last meeting. The first one was Norwood Golden Bull, which is a butcher shop, which also offers a retail section selling prepackaged food. And the second location is Simple Nutrition that has opened as well. They are a meal replacement. They offer meal replacement drinks and protein shakes in the establishment. That's also in Washington Street as well. And they were permitted on July 6th.
Can I ask you, Angelo, how often are we going to be inspecting the Norwood Golden Bull? The only reason I ask that is we used to have a butcher shop up in that area, and we had some problems with them. So I wanted to make sure that we had sufficient number of inspections going forward. We can always cut it back, but I would like to make sure that we have, we put them on 4 times a year, at least for a year, to see how things are going, just to make sure things kept sanitary, so to speak.
Sure, we can do it 3 times per year. I'm going back in a couple of weeks to do a follow-up since they've opened. And then we can certainly put them on the list for 3 times a year. That's not an issue at all. We can do that.
Okay, all right.
Okay.
Yeah, what happened to Spot? How are they coming along?
I haven't heard anything lately from Spot. I understand they were at the end of their construction phase. I haven't heard an estimated date of opening. So I can reach out to Perry and just find out and inquire about it. Otherwise, like I said, I haven't heard anything from him in quite some time.
Okay. And Mustang Pizza, when do they think they might be open?
I just received did plan review a few days ago. It is on my desk to be reviewed. So they're probably several weeks away. They are at the location where Stable used to be, where Papa John used to be before that,
Yeah.
Mhm.
the Lennox Plaza. So,
Right.
but it might be a few weeks before they open, to get inspected and open.
Okay.
Thank you.
Okay.
Yep.
We ready for the inspection report?
I am.
Go ahead, Angelo.
Sure. As you can see from the reports, a lot of the spotlight is still on COVID enforcement.
Yeah.
There have been some inspections that are in here, or follow-ups that are in here that are non-COVID related as well. But the majority of it is still complaints related to COVID enforcement. I don't have anybody to highlight on the list, but certainly if the board has any questions about an establishment, feel free to ask.
Okay, I just wanted to ask, it just seems like when you go and recheck to see if they're having masks, you're not doing it like in the morning when everybody's fresh and they want to wear their masks. More like towards the middle to the end of the day, check to see if they have masks on, that type of thing. I would assume when at the very beginning when they open up, everybody has their masks on and, you know, they're not overheated and all that sort of stuff. But, you know, when do you do your inspection, so to speak, on some of these restaurants and stuff? Well,
To be honest, it does vary. It could be the morning, it could be lunchtime, it could be late afternoon. There is no set time when I go out to do
Okay.
investigations. A lot of times when I do go in, many establishments are wearing masks. They're wearing them properly. So a lot of time, I'm not saying that complaint is not valid. It's just, you know, when I go there, I can only report what I see. So sometimes they'll have it, you know, not over their noses, which, you know,
That's the biggest complaint I've heard, is that they have them on, but they're not over their noses.
right. So we do talk about that. I do talk about that with the person in charge and their staff. So a lot of it is educating COVID-19 enforcement with them and the standards with them and reviewing the standards with them as well. And a lot of it, again, is regarding face covering, social distancing complaints.
Okay. I noticed there's no criticals this month, which is a good thing.
Right.
Now, when you go to check on a complaint, do you tend to do an inspection at that time or just check on the complaint?
I just check on the complaint is how it usually works. So if I get a complaint, I just go there for the complaint.
Okay.
Complaint and follow up on the complaints.
Okay. Have we been doing regular inspections?
I've been doing pre-operational inspections, emergency inspections, pre-op inspections. Obviously, pools are in there as well. Mobile trucks. I do have an ice cream truck today that hopefully will get permitted and be out in the field soon. So I'm going to start my routine inspections in the next couple of weeks regarding high-risk locations. As your chateaus, your Jake and Joe's, those type of establishments.
Okay. Okay. Very good. How are the pools doing? Do we have them down anywhere?
Good. I'm actually doing several this week and finish them up for July next week as well. And then I'll do them again in August as well for the season pools.
Any problems with any?
No issues. No, I haven't heard any complaints or at all about the pools. No.
Good.
Good.
That's a good thing. Okay. And with the ice cream truck opening up, there will be 2 people in that truck?
Correct. Yes, they've been. I do send them the town bylaws and regulations regarding 2 people on the truck. A lot of them are missing the required paperwork and documents they need to submit to me before we can schedule an inspection. So a lot of that for them has been a holdup. It's the same ice cream trucks that operate in town every year. And for some reason, I think the find it hard to get organized with all their paperwork. So it's usually last minute. That's why I haven't a perimeter truck this season as of yet. Like I said earlier, hopefully I'll do one today and they'll be ready to go. I do have all their paperwork, so they should be okay. So they will be expecting in about an hour, head out to the field and inspect them. But that's been usually the hold up with them is the requirement.
And Angela, what is the name of that company that you're permitting today?
Today is Lunch Brothers ice cream truck.
Yeah.
And second ice cream truck actually is going to be a new ice cream truck that wants to operate in town. They're called Sweet 16 Ice Cream out of Sharon, Mass.
Yeah.
Spoke to them on Friday. Again, I still need some of their paperwork, scheduling an inspection. I'll not schedule one until I receive all the required paperwork from the police department.
All right. Any other questions, anybody?
I have a question.
Go ahead, Carol.
Angelo, hi, Angelo. When Norwood had that thunderstorm or when that burst come over Norwood, how did the places, were you involved in any of, being called to any of the restaurants or anything that was damaged that you had to go out and inspect?
I have not, no.
Okay, good. So everybody kind of handled it by themselves. We weren't notified of anything that we had to go inspect.
Correct.
Thank you. That's all.
And I understand that the hospital is working with you, Sigal?
In as far as the repairs?
Yeah, and, you know, notifying you about what's going on? Has Sal got in touch with you at all?
No. Any updates I hear is from the general manager.
All right, I thought you were involved in those talks. The next time they haven't, I would suggest that you tell Tony that you'd like to be involved just so that we know what's going on.
Yeah, I think there's an effort to establish routine communication between the town and the hospital. So I think we could all improve on that.
Okay, yeah, okay. Because we haven't had a CBAC meeting, you know, the town meeting, so I was just wondering if they had been in touch with you at all.
No, you knew a lot more information than I knew for sure. So I think I'll be connecting with you to see what updates are happening too.
Okay, all right.
Thank you.
Okay. So no other questions for Angelo? We're good? Thank you, Angelo. And on to the director's report.
Sure. So back on July 6th, we moved into phase 3, step 1. I keep saying we do expect there will be steps within phase 3, but we don't know how many and what will happen within each step. We will not go on to step 4 until we have a vaccine or some other medical intervention. So we'll be in step 3 for a while here. A bunch of things opened in phase 3, fitness centers, museums, changes to outdoor recreation, some changes to open space, playgrounds, things like that. So we saw those opening again, each one with their specific safety standards that need to be followed. Indoor gatherings were expanded to allow 8 people per 100 square feet, but not to exceed 25. So now there's a limit on 25 people in an indoor gathering. And then some limitations on formalized events in outdoor spaces that you need to maintain some capacity limits and can't be over 100 people. So a lot.
And that's about, let me interrupt. That's a function, 25, what you're talking about for restaurants in function halls and weddings and gatherings, that's what the requirement is.
Right, you can't have a gathering more than 25 people. And even in an outdoor gathering, like event, like a wedding, they don't want to see more than 100.
No more than 100. Okay.
Okay, but
so
yeah,
other
that's what I
things
think. So nothing's really changed.
No, it was just expanded a little.
Okay, thank you.
So along with those safety standards, we received a couple this morning, but we have about 60 complaints we've received since we started logging them in May, since we started to sort of close up and then reopen. And like I've talked about here before, constantly changing requirements are very difficult to enforce. And Angelo does do a lot of that. So I want to thank you for that. And it's been, some of them are food establishments and some of them are not. So it's sort of taking us all out of our regular roles and expanding them for sure. A lot of times sometimes it's a phone call. A lot of times it is a site visit to have a conversation with a manager or an owner about the safety precautions. And most people are compliant. It's just a matter of communicating what was done wrong. A difficult one, we are seeing some complaints around youth sports. It's really the spectators and the parents not wearing face coverings and not social distancing. So we just want to remind people that it is very important, even in those outdoor environments, that you still maintain social distancing and wearing your face covering. And I don't want to get too into the specifics, but the youth sports guidance is on the state website, and links to that are on our website. But that everybody should be wearing face coverings and maintaining social distancing when they can. Different sports have different requirements depending on the risk of the sport and really how much contact you come in with other people. We talked a little bit about the schools already, but we're working with them closely on sort of the reopening plans and those 3 plans that we talked about earlier. We also, I've been working with Aubrey on positive messaging around wearing face coverings. I think it's important as we continue to open up to remind people. We don't sort of want to, now that we've opened up so much, we don't want to fall into those old habits of how we used to be. We need to make sure that we remain vigilant with the face covering and the social distancing and the hand washing. And then I can answer any other questions about sort of my other meetings. We do continue to meet on a daily basis with the incident command team to just make sure we have everybody knows what's going on and we're communicating.
Have we gotten lots of complaints about what sports have been open? Like, practices going on and sub camps. Have we been okay with all that? I mean, we have lots of calls like the kids aren't distancing themselves or they're not wearing masks or,
Yeah, we've had those couple around the youth sports that we've addressed with the organizers. It's a little hard because it's not so much of a business we can go visit and, make sure they're wearing face coverings. It happens intermittently. So we have been working with the recreation department too, who sort of regulate the fields, and they've been great in helping us monitor that.
That's good. That's great.
Yeah.
Thank you.
Okay, next up is board's agenda. Carolyn, do you have anything?
Nope, I had to storm the sports and the pools and they've all been answered. Thank you.
Welcome. Joan, how about you?
No, I'm all set. I got all my questions answered.
Okay. Stacy, do you have anything to add?
Nope, I think you covered it all. Good job, everyone.
Okay. Aubrey, anything? Anyone else? Nick, Angelo, any questions? Nope, they're gone. Okay. As far as I'm concerned, I want to just say thank you to everybody for working so hard. This has been a tough summer for you guys. It's been tough since March, and I just want to say thank you for all the hard work that you're doing, and thank you to the people in Norwood who have really rallied around this, masks on, and so just want to say to everybody, keep your masks on. It does make a difference.
Okay, Kathy, I just want to ask if we're going to be meeting at Town Hall on September 8th, or are we meeting virtually again?
Well, I'll leave that up to Sigal, because I don't think the town hall is open as yet. Correct, Sigal?
No, it's going to open in September. Am I correct?
Yeah, right now the plan is to try to assess it after Labor Day and probably open up. Assuming like every announcement we make, assuming the numbers still look good, assuming the data is the way it is now. I think the guidance right now is still, if you can work from home, you should. The governor has not called back executive branch employees yet. They are still working virtually. I think it's important for the board to really lead by example. And if we don't have to meet physically, I wouldn't recommend we do. It's obviously up to the board to make that decision. But I think the more we can lessen interactions between people, the better. Even as we look to open things up, if we don't have to do it physically in person, we shouldn't.
Okay. Thank you.
All right?
Yep.
Speaking
Oh,
of that,
Sorry, let me,
go ahead.
I'm sorry, I just want to add, also because of open meeting law and the limitations on the number of people, now I know we don't usually get over 25 people at our meeting, but we do have to make sure that we're open and can accommodate that.
Yeah, and can still social distance 6 feet apart. So that could be a little tricky. Okay, so next meeting is September 8th at 10:30.
September?
Yep, September 8th. We tried to delay it out 6 weeks because we weren't sure with vacations and everything that we were going to be able to get one in August, so we're doing it early in September. All right, someone want to make a motion to,
Motion to adjourn.
I second.
all in favor?
Aye.
Aye. Meeting adjourned.